The liver channel diagnosis. Cold stagnation in the liver channel. Fullness and distension in the epigastrium, with pain which refers downward to the scrotum and testes, and upwards to the hypochondrium. The pain is alleviated with warmth, straining of the testes, or contracting of the scrotum. Vertical headaches, feeling of cold hands and cold feet, vomiting of clear watery fluids or dry vomiting. In women there can be a shrinking vagina, pale and wet tongue, with a white coating, deep, wiry, slow pulse. Damp heat in the liver and gallbladder. Fullness of the hypochondrium, abdomen or hypogastrium, bitter taste, sticky taste, poor appetite, nausea, feeling of heaviness in the body, yellow vaginal discharge, vaginal itching, vulvar eczema or sores, mid-cycle bleeding or pain, pain and redness and swelling of the scrotum, genital or papular or vesicular skin rashes and itching, urinary difficulty, burning on urination, dark urine, red tongue with redder sides, with sticky yellow coating, slippery, wiry, rapid pulse. Heart and liver blood deficiency. Palpitations, dizziness, insomnia, dream-disturbed sleep, poor memory, anxiety, a tendency to be startled. Dull pale complexion, pale lips, blurry vision, floaters in the eyes, diminished night vision. Tingling and numbness of the limbs, scanty periods or amenorrhea, cramps, muscular weakness, dry hair and skin, depression, a feeling of aimlessness, withered and brittle nails, pale and thin tongue, choppy or fine pulse. Liver blood deficiency. Dizziness, numbness, tingling in the limbs, insomnia, blurry vision and floaters in the eyes. Diminished night vision, scanty menstruation or amenorrhea, dull pale complexion without luster, pale lips, muscular weakness, cramps and withered nails, dry skin, dry hair. Depression, a feeling of aimlessness, pale tongue, thin and slightly dry tongue, choppy or fine pulse. Liver blood deficiency leading to wind, fine tremors, facial tics, dizziness, blurred vision, numbness or tingling of the limbs, poor memory, insomnia, scanty periods. Liver blood stasis, hypochondrial pain, abdominal pain, vomiting of blood, epistaxis, painful periods, irregular periods. Menstrual blood dark or clotted. Infertility, masses in the abdomen, purple nails, purple lips, purple or dark complexion, dry skin. Purple petechiae, purple tongue, and a wiry and firm pulse. Liver fire blazing. Irritability, a propensity to outbursts of anger, tinnitus, deafness, temporal headache, dizziness, red face and eyes, thirst, bitter taste, dream-disturbed sleep, constipation with dry stools, dark yellow urine, epistaxis, hematemesis, hemoptysis, red tongue and redder on the sides, dry yellow coating, full, wiry, and rapid pulse. Here, a red tongue with redder sides and a dry yellow coating would be enough to diagnose. Liver fire generating wind. Tremor, irritability, propensity to outbursts of anger, tinnitus and or headache, deafness with sudden onset, temporal headache, dizziness, red face and eyes, thirst, bitter taste, dream-disturbed sleep, constipation with dry stools, dark yellow urine, epistaxis, hematemesis, hemoptysis. Tongue is red with redder side and dry yellow coating. Pulse is wiry and rapid. Liver fire insulting the lung. Breathlessness, asthma, a feeling of fullness and distension in the chest and hypochondrium. Cough with yellow or blood-tinged sputum. Headache, dizziness, red face, thirst, a bitter taste. Bloodshot eyes, scanty dark urine, constipation. Tongue red with redder sides and dry yellow coating. Pulse wiry. Liver invading the stomach. Irritability, epigastric and hypochondrial distension and pain. A feeling of oppression in the epigastrium. Sour regurgitation. Hiccups, belching, nausea, vomiting, sighing, weak limbs. Tongue is normal colored or slightly red on the sides. Pulse wiry on the left and weak on the right, or wiry in both middle positions. Liver chi rebellious. Hypochondrial or epigastric distension, hiccups, sighing, belching, a churning feeling in the stomach, irritability. In women, distension of breasts. Tongue is normal or slightly red on the sides. Pulse is wiry. The key here is belching, irritability, wiry pulse. Liver chi stagnation. A feeling of distension of hypochondrium, chest, epigastrium or abdomen, sighing, melancholy, depression, moodiness, fluctuation of mental state, feeling wound up, and a feeling of a lump stuck in the throat, plumpit chi. Irregular periods, distension in the breast before the menstruation. PMS, irritability. Tongue. The tongue color may be normal. The tongue color may be slightly red on the sides. Pulse wiry. Liver yang rising. Headache that may be on the temples, eyes, or lateral sides of the head. Dizziness, tinnitus, deafness, a blurry vision, dry mouth, dry throat, insomnia, irritability, feeling worked up, a propensity to outbursts of anger, stiff neck. Tongue may be pale if there is liver blood deficiency, or without coating if there is liver yin deficiency. Pulse is wiry. Key here is the throbbing headache and the wiry pulse. Liver yin deficiency. Dizziness, numbness or tingling of the limbs, insomnia, blurry vision, scanty menstruation or amenorrhea, a dull pale complexion without luster but with red cheekbones, muscular weakness and cramps, withered and brittle nails, very dry hair and skin, depression, a feeling of aimlessness, normal colored tongue without a coating or with rootless coating. Pulse is floating and empty. Rebellious liver chi invading the spleen. Irritability, abdominal distension and pain. Alteration of constipation and diarrhea, like IBS. Stools are sometimes dry and bitty, and sometimes loose. Flatulence, tiredness. Tongue may be normal or slightly red on the sides. Pulse, wiry or wiry on the left and weak on the right. Stagnant liver chi turning into heat. Hypochondrial or epigastric distension. A slight feeling of oppression in the chest. irritability, melancholy, depression, moodiness, a feeling of lump in the throat, plumpitchy, a feeling of heat, red face, thirst, a propensity to outbursts of anger, PMS, irregular periods, premenstrual breast distension, heavy periods. Tongue is red on the sides, pulse wiry. Key here is a feeling of distension, a wiry pulse, red sides of the tongue.